and welcome to the Critical Care Shared Service here at Fairfield General. My name is Greg Bleakley and I work as one of the practice educators in critical care. Critical care is the medical and nursing care of people who have sustained life-threatening illness, injuries or disease processes, and that care usually takes place on a special unit called a critical care or intensive care unit. A team of specially trained healthcare professionals provide a 24-hour cycle of care. These professionals typically include critical care doctors and nurses, advanced critical care practitioners, and other important members of the multidisciplinary team, including physiotherapists, occupational therapists, pharmacists, dietitians, and others. Of course, critical care is also supported by administration, domestic and housekeeping colleagues who support the operational delivery of the service and, most importantly, a clean and infection-free clinical environment.
Hello, my name is Lynn Reynolds and I'm the Unit Manager for our critical care here at Fairfield. Our main goal is for all our patients to have a good patient experience and to ensure that staff are open and honest with both our patients and their families. We actively encourage families to provide feedback so that we can identify any areas where improvements can be made. We have also recently received our 4th consecutive Green NAS, which highlights the great care that all of our staff strive to deliver.
Hi, I'm Gemma. I'm the pharmacist on the critical care unit. I cover Ward 10 and I also cover Apollo for any patients that we may have on there. My role is to ensure that medicines are used safely and effectively for all the patients on there. I also complete the medicines reconciliation for every patient that comes onto the unit. So this is to ensure that regular medicines are continued where appropriately. I can provide any sorts of advice on medication queries. For example, I can provide advice on doses of medicines to be given and any administration instructions. For example, what fluid the medication may go in or anything like that. I also order medicines for patients on the ward, so if a medication is unavailable, you can come to me and I'll get that medication sorted for you. I keep an eye on the stocks that you've got on the ward, so for example I can order things like propofol if you've not got enough of that, and also controlled drugs.
Hello, my name is Swapna and I work as a registered nurse on the critical care unit. I arrived in the UK as an international recruit from India. I find the team to be supportive, cohesive and caring. I really like the work here and I have the privilege of working with a dynamic and friendly team. Some people stay on critical care for a few days, whilst others may stay for prolonged periods of time. Many people who are admitted to critical care go on to make a good recovery. Sadly, some people are so unwell, they are unable to survive, and the critical care team focus on providing a high standard of end-of-life care.
Hello, my name's Rachel. I'm an occupational therapist covering critical care here at Fairfield. This is a relatively new area of practice for myself and also for occupational therapy as a profession. The main focus of my role is around early mobilisation, which is maintaining a range of movement in the upper and lower limbs through function, and also looking at the assessment and treatment of delirium. As occupational therapists, we are person-centred and holistic in our approach, enabling patients to perform daily functional activities that are important to them. Working collaboratively with other members of the MDT, my aim is to improve patient experience and reduce lengths of stay through early intervention.
Hi, my name is Jess and I'm the lead nurse. Another important aspect of critical care is looking after and caring for the family, relatives and carers who are often acutely upset and distressed. We have a dedicated relatives room that can be used if needed. We want to promote a culture of discovery and personal learning and welcome all learners to our unit. With the support of our practice education lead team, you will have the opportunity to witness and be actively involved with caring for some of the sickest patients in the hospital and their respective loved ones. Critical care is a truly rewarding area of nursing, and we hope you enjoy your time with us.
Hello, my name's Nick and I'm one of the physiotherapists. Physiotherapy is essential in the early stages of critical illness to preserve strength, maintain joint range of motion and optimise respiratory function. We're involved with the maintenance of lung volumes and clearing of sputum from people's lungs when they're relying on a ventilator to breathe. As patients begin to recover from serious illness or complex surgery, physiotherapists are key in the early mobilisation of patients and begin the journey back to normal function with a personalised rehabilitation plan.
Hello, my name is Zoe and I work as a clinical research nurse in critical care. Research plays a vital role in delivering life-saving advances. Modern nursing is based on evidence-based practice and it is part of my job to gain that evidence. I also recruit patients to studies using strict parameters. Part of my role is to ensure the patient or their next of kin is made fully aware of the study and how the study would benefit healthcare both short and long term. The evidence can be used to transform healthcare and ultimately save lives.